Hey, it's Melody. Welcome to A SANER Spin on Crazy, episode 11 this week. This week I'm talking about Minority Mental Health Month. It's July, and that's what July is, Minority Mental Health Awareness Month. I think having all these months is something that has always been kind of weird to me, struck me as odd and kind of gimmicky. But I realize why they need to exist. There's some, the Feline Gingivitis Awareness Month maybe doesn't need to exist, but not that cats' teeth aren't important. But I'm saying people aren't paying attention to these issues year-round, and they won't. And unfortunately, unless we pick a time and say, look, we need to pay attention to this, people won't, and add a name to it and do all the things we've done. So here we are. Anyway, this week, in honor of Minority Mental Health Awareness Month, I will be hosting a Twitter chat on Wednesday from 11 to 12 through Mental Health Social Media Chat. And thanks to NAMI, the National Alliance on Mental Illness, and the NED, and the National Network to Eliminate Disparities in Behavioral Health. So we're all getting together to host this Twitter chat, and you guys can ask whatever questions you want. And we have some questions as well that hopefully will help evoke more discussion. And the next day, I will be joining to take part in a celebration webinar for Minority Mental Health Awareness Month. And that is Thursday, July 10th from 3 to 4 p.m. It's a webinar. You can register. I will put a link here as to how to register for that, and it'll give you details also about the Twitter chat. So that said, the question this week was, why does it matter? Why does minority mental health matter? Why is it different? It matters because the ways that different non-dominant race groups are affected, non-males are affected by mental health issues and how they're treated within the mental health community differ and point to a lot of historical discrimination and stigma within the mental health community and within the medical establishment. So there exists a certain level of distrust in certain historically marginalized groups, whether it be the LGBT community, because being homosexual used to be in the DSM as a mental illness that needed treatment to be cured up until the 70s. Or whether it be blacks in my state of North Carolina who, up until 1977, we had a eugenics board that sterilized people and sterilized thousands of people for being mentally defective, and feeble-minded as well. Turns out they weren't really mentally defective or feeble-minded. For the most part, they were just black and poor. So yeah, obviously there's going to be some distrust of the medical establishment, and it's going to be completely legitimate. But what ends up happening is that will also stand in our own way of getting help. If the help that's being provided isn't of the sterilization variety, which at this point, most of it isn't. It's not being used against us in that way. Certainly there may be pockets of things happening, and I'm all about conspiracy theories. Maybe something's happening, but for the most part, our current medical establishment is trying to help us and recognizes that, as much as even calling this Minority Mental Health Month, that's great. We'll be the majority soon enough, and by we I mean people of color. So that even is changing. So I mean, we're definitely in a time that's changing in a lot of different ways, both with respect to how we view mental health and how we view minority communities, whether they even are minorities anymore. But the truth is, in certain historically marginalized groups, we have higher suicide rates. The LGBT example is a great one, of much higher suicide rates, and a lot of that has to do with stigma. And a lot of the higher suicide rates in communities of color have to do with having higher stigma within our own communities. And again, this fear and distrust of the medical establishment, particularly psychiatry, when it's been used against us in the past to discredit us. So I think these are important things to talk about, and I really look forward to hopefully some of you joining in on this webinar, and we can have discussion afterwards, and also with the Twitter chat, I'm willing to continue talking about this issue. I spent, and I talked about before, I spent a good amount of time in psychiatric hospitals, a good amount, more than anyone ever should want to spend in psychiatric hospitals, and I will tell you that my experiences there, though, minimal things, not huge things, whether it's from getting served bacon over and over after telling somebody, no, I'm Muslim, I don't eat pork. Bacon is actually pork. Honestly, like those kinds of things, not a big deal compared to some of the things that have happened historically, but I think it's worth becoming more culturally proficient, and that our healthcare providers owe us that, to just respect us and respect our cultures and our backgrounds more than they currently do, and just get with it a little when it comes to cultural literacy. That said, I'm over 5 minutes again, and I will talk to you again next week. It's been great. Bye. Hopefully I'll see you at the webinar and stuff. Like I said, the link is here. Bye.